Hi, this is Dr. Sean Jones, Director at Chattanooga Wellness Centers, and I'm here today to talk to you about nutrition response testing. Now, nutrition response testing is an incredible tool of using a system of muscle testing, and muscle testing is a binary system of communication. It means we get yes-no answers as long as we only ask your body one question at a time. So with nutrition response testing, there's always an answer for any health issue. Now, most of you, when you have a serious health challenge, you're taking everything under the sun. You're taking any supplement you can find, trying to feel better. And that can confuse the body and actually slow down healing. What you need to do is you need to know what you need to take and what you don't need to take or no longer need to take. And I have a system to do that at our Chattanooga Wellness Centers in Cleveland and Chattanooga. Now, nutrition response testing basically asks your body a series of questions. There's something called blocking and there's something called switching. Those will interfere with a good test. We have to get those cleared out of the way before I test you. So most of the program that I put people on is to clear out blockings and switchings, and then their body can heal. Let me explain that. Your autonomic nervous system has two parts. You have your sympathetic and your parasympathetic nervous system. Sympathetic is stress, fight or flight syndrome. Parasympathetic is relaxation. That's in charge of sleep, bowel control, bladder control, sexual function, heart rate, digestion, respiration. All the bedroom functions are parasympathetic relaxation functions. And so they should be like two pistons in a lawnmower engine. One should go up while the other goes down. Now let me explain what blocking is. Blocking is where one of them is stuck. They should call it sticking. Where one of the pistons isn't firing. That means your body's not responding to its environment properly, and therefore it cannot heal properly, or it cannot regulate its systems properly. So by clearing out blockings, your body can start regulating again. Now let me explain switching. Switching is when sympathetics go up when you get up in the morning, parasympathetics should go down. If you're switched, it means your parasympathetic nervous system or sympathetic is going the wrong direction. So in the morning, when the energy starts to kick up, so does the inhibition. And now you have no net energy. Whereas if the sympathetics go up and parasympathetics go down, look at all the net energy you have to take on the day. Likewise, are you having insomnia? Are you not sleeping good? I'm going to show you today how we at Chattanooga Wellness Centers can fix it without using drugs, with no kind of big deal. All we have to do is fix the parasympathetic nervous system. Think about it. When you take pharmaceutical grade fish oils, never take regular fish oils you just buy at Walmart or Sam's or Target or anywhere. It's got to be pharmaceutical grade. By the way, everything I carry is pharmaceutical grade products. So that means it's pure. There's no mercury, no dioxin, no poisons in the fish oils, okay? That's very important. When you take fish oil, it forces the parasympathetic nervous system to upregulate. Now, when do most of you guys take your fish oils? If you take them at all, you take them in the morning. Wrong. You take one in the morning to feed your heart. You take the rest 45 minutes before you want to go to sleep. And if you take our stuff, I guarantee if I test you and it's going to work, it'll work and you'll sleep better or you get your money back. That's how sure I am if I test you and I make sure you need it. So when you take your fish oils, it should be 45 minutes before you want to go to sleep, so it helps upregulate your parasympathetic nervous system. Now I'll show you what the test looks like for that. This is Melanie, one of my assistants here. My lovely assistant is going to bring her leg up. Now I'm going to test the muscle here. Hold hard. Strong as an ox, but definitely no resemblance at all. Okay. Now I'm going to pump real fast on her leg. This is going to elicit fast twitch fibers. That's the ones that you sprint with. Hold real hard. Hard as you can. Hold. Now hold hard. Hold real hard. So she's on fish oil, but she's not taking enough of it. So let me grab the fish oil here. I'm going to set her on her tummy here. Now, everything that's organic matter has 2 feet of energy around it. So this is energetic medicine that we're using to test your body. With the parasympathetic nervous system, when I put this on the body, the brain goes, oh my goodness, thank God she swallowed what I need. Now, the body thinks she swallowed it. Hold up hard. Now hold. 1, 2, 3, 4, 5, 6, 7, 8. Now her leg is strong. Let me take that fish oil away. Set it right there for a second. I have to give 3 or 4 seconds for the energy to clear from the body. And come back here, hold hard. Hard as you can. There's nothing there. As soon as I do fast twitch fibers, it goes weak. So that means that she's deficient omega-3s. Now, if she's deficient omega-3s, it also means she's not sleeping as good as she could be. So she needs to make sure she takes enough. We're going to test the quantities today on this nutrition response test. And so this is called the tuna oil test. I do this for free on anybody that stops in. I want to check you real quick. I'll just check it. I'll show you how much better it is. Remember, when you sprint, you don't breathe. It's not the Krebs cycle. It's not oxygen. When you sprint, you're only burning fat. Now, your heart only burns fat. It does not burn blood sugar. It cannot burn blood sugar. Burning fats is much more efficient because fats are 9 calories per gram versus sugars are 4 calories per gram. So since you were 2 weeks old in the womb, the heart's been beating, it's been burning the yolk sac and later the mama's fats from the bloodstream is burning for the baby's heart until the baby's born. Then you have to have fats. If you don't have good fats, the heart can't function properly. So the first step to sleeping better and getting good heart function is to make sure you have the right omega-3 levels, and we test that in the office here. Now, Melanie's situation, I've already gone and pre-tested to save some time. I know what products are going to open up a regulation. Let's go through and check her for blocking and switching. The first step I do, lock the elbow, hold hard, is I'm going to check right here at the glabella. One way should go weak, one way should be strong. All that means is we're in sync, that we can move forwards. If it doesn't go weak and strong, I've got to fix that, but she's okay. Now here's how you check for blocking. When I stretch my hand, or you stretch your own hand, it creates an electromagnetic field in your hand. When I hold this over any body orifice, the body should recognize it. If it recognizes it, the arm will go weak. Let's test it. I'm going to put it right over the belly button, stretch my hand like this, hold, no blocking. I'm sorry, blocking. It's not going weak like it should. Now it turns out Melanie has a little remnant of a kidney stone, and that's what the main issue is. Can you pass me that basket, please, Carrie? I'm going to use a little plastic basket here to hold the products. So I'm going to take the product called KDIR, which, by the way, if you suffer from kidney stones, we have the only product out there that is safe and effective to wipe out the kidney stones. I don't care how big the kidney stone is, it will dissolve it away. It's called KDIR. When I put this bottle on her body, that energy field mixes with her energy field, and now her arm goes weak. That means that her body recognizes it, and that this opens the regulation so she can start healing herself. When you're blocked, you can't heal yourself properly. Good. Now, just like the farmer's commercial says, moving on. Let's check the ear blocking. Lock your arm. When I stretch my hand, put it over her ear, it does not go weak like it should. So we're going to take the next one, which is garlic forte for a little infectious challenge that she has. Boom. And it opens regulation. That's the body telling me, yes, I need this in order to heal myself. So that's what we do. Again, this system tells you exactly what you need and what you do not need to take any longer. Now let's check mouth blocking. The mouth blocking is blocked. Now pass the stress kits over to me. I want you to understand something. I already did some pre-testing. Both of them, please. So there are 4 main stressors in the body. Okay. On this one we have infectious challenges. I can't say infections in my license. But if the body's got a bacterial challenge, viral challenge, I can check to see what the body's doing, how it's handling it. Foods are another stressor. If you're sensitive to foods or need digestive help or aids to help digest, then you have heavy metals and chemicals. So these are resonance vials that when I place them on the body responds to them. So I know what type of infection or what type of a challenge is causing the body not to work right. So these are called stress kits. I've already used them to save time today. Now, so on the mouth, we have mouth blocking, and it turns out she has a lot of sinus issues too. Antronex is from organic erased cow liver enzymes, boom, and now she's no longer blocked. So this is going to help pull mucus out of your sinus cavities. If you're suffering from sinuses, like so many people do in this area of the country, stop by Chattanooga Wellness Centers in Cleveland or Chattanooga. You don't have to be a patient. You can get some Antronex. It's safe and effective. It pulls mucus out of your sinus cavities. In 3 or 4 minutes, you go, wow, that opened me up. Without using drugs, without being spacey or dried up and your eyes get all dry. None of that. No side effects like that. The only side effect is you feel better, which is awesome. All right, now there's 2 more body orifices that are below the belt. So we're going to have the patient use her hand. Stretch your hand like this. Left hand, put it right over the groin area. All right, we're going to check that body orifice and it's blocked. So we're going to take this one is Cataplex ACP. It's a drainage formula. Boom, that opens up the regulation. It actually drains the lung and the bladder, and she had some issues in both areas, so it's going to pull mucus out of any of these areas from any infectious challenge. Good. Now, bend your left knee. The last one, of course, is anal blocking. So put your hand right over the rear end. She's stretching like this to create electromagnetic field with herself, and it's blocked. And so it turns out her colon needs to calm down a little bit, so we use chlorophyll for that. And when I put chlorophyll on her body, boom, the body recognizes it. All right, you can take your hand away. All right, go wash your hands. No, I'm teasing. You're fine. So now we have all the blockings cleared. Now we have to check for switching. Remember, switching is, instead of something stuck, we're blocking it. Switching is one goes the wrong way. Fortunately, she had no switching. We just put the pinky thumb together with the eyes open, eyes closed, add ring finger, eyes open. No switching on the right. Left hand, pinky thumb, eyes open, eyes closed, add ring finger, open eyes, no switching on the left. Now there's 148 levels of switching. That's just the first 8 levels. if we run a test, it's called a heart rate variability study. When you come in as a new client, we run this test. It gives you an overall, you can rest your arm for a second. It gives you an overall health score, okay? So we know how you are compared to 30,000 other people. It's a very accurate score on how your overall health is right now. Also, it gives us a graph where I can see if there's any blocking or switching on the graph. If I see a switching on the graph, then I keep digging down all 148 levels if I have to until we find where the switching is. Because to fully heal, we have to get rid of all blockings and all switchings because they inhibit the body from healing. So now that she has no blocking or switching, we can test her. Now the main issue right now was the bladder. So all I'm going to do is lock her arm. I'm going to put a little stress right over the bladder area above the pubic bone there, and it goes weak immediately. Okay. When I put the tuna oil on that she tested for, I'm going to test. It should pulse to a 10. 1, 2, 3, 4, 6, 7, 8, 9, 10. There we go. It pulses to a 10. That's all she needs. I can stop right there. Now the bladder is back to a 10. Everything else is balanced in her body. That's enough. I don't need to give you more supplements. That's enough for her body to heal. So now what I'm going to do, and Carrie's going to write down quantities for me. I'm going to check quantities on these products. Now when we want to check quality, I put things on her tummy, okay? Because quality, the stomach can tell me if it's helping you or not. But quantity, you have so many nerve fibers in your hand. When I put a product in your hand, the brain can register that, and I can actually see how much quantity you need. So let's check quantity. This is the KDIR, which again, helps to dissolve kidney stones safely and naturally and beautifully. It's a wonderful product. How many do you need a day? 1 a day, 2 a day, 3 a day, 4. It goes week on 4. So 1 first thing in the morning, 2 before bed. I like to do KDIR on an empty stomach because I don't want food interfering with it. I want to go right in and start dissolving those kidneys. After 30 minutes, you can go and eat. It'll get absorbed and start doing what it needs to do. Now, let's check the fish oil. Pharmaceutical grade tuna oil. And 1 a day, 2, 3, 4, 5, 6, 7. 6 a day, 1 in the morning, 5, 45 minutes before bedtime. And that's important because you have to give it time to kick up. Don't take it right when you're going to bed. Take it 45 minutes ahead, and by the time bedtime gets there, you're going to start hitting yourself with a book or your cell phone, falling asleep on yourself, and that's a good thing. It makes you rest well. There's 2 rules of thumb in my office, by the way. To heal up, we got to make sure your bowels are moving every day, at least once a day, preferably 2 to 3 times a day, and we got to make sure you're sleeping good. If I fix that, you're going to keep getting better and better over time. Now, take that one. Next one is garlic forte. Hold this arm up. Garlic forte. 1 a day, 2, 3, 4, 5. So 4 a day. It goes week on 5, so 4 is enough. So we're going to take spread out breakfast, lunch, dinner before bed. All right, now we have Cataplex ACP. I love Cataplex ACP because it has organic buckwheat in it, which is very, very good for the body to heal for many, many different things. And it's a drainage form. It's going to pull mucus out of the bladder and out of the lungs. 1 a day, 2, 3, 4, 5, 6, 7, 8, 7 a day. So we're going to do 4 in the morning, 3 in the afternoon to help pull up, like dinner time, to help pull the mucus out. But like with any drainage form, if it's a tough day, if you're having a lot of respiratory stuff or bladder stuff, you want to take more, of course. And Melanie knows that because she works for me. Now, Antronex. I love Antronex because it's made out of organic raised cow liver enzymes, and it's going to pull that mucus out of your sinus cavity safely and effectively with no side effects. It doesn't interfere with any medication you might be taking. It's a wonderful product. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11. So 10 a day she's testing for. So 5 in the morning, 3 at lunch, 2 at dinner. Because most people are most congested first thing in the morning, that's when we go ahead and check and take the majority of it to get you feeling good. Because why suffer? Here's a rule of thumb about taking Antronex or any other drainage formula for sinuses. If 10 doesn't do it that day, take 15 or 20, whatever it takes to get you over the hump. Why be sick for 2 weeks? Take it, get over the hump in a day or 2, and get well. You don't have to sit there and be sick. So, and that's why every patient has my cell number. If they have a question, you're supposed to text me. That's on my card. Everybody gets that number. Now this is chlorophyll. Great product. This calms down the whole digestive tract if it's a little inflamed. And she had mentioned she felt like it was kind of inflamed on her. This is going to calm everything down. 1 a day, 2 a day, 3, 4, 5, 6, 7, 6. So 6 a day, 2, 2, 2. Breakfast, lunch, dinner. And that is going to just calm down the whole digestive tract from the stomach all the way out to the other end. It just relaxes and calms everything down. So we now have a program. She needs 6 products. That's all. Just 6 products. There's only one other person certified in town that does nutrition response testing, and they make you buy all kind of extra products. We only give you what you need, not what you don't need. Now, on your second visit, what we do is we have you bring in anything else you might be taking on your own, supplement-wise, not medications. I can't take your off or on a medication. But your supplements you bring in, and I'll see if you still need it or not. I can test that. Once your body's used to our program, it'll tell us if you still need that other stuff or not. Most of the time you don't. Some stuff you do. It just depends. So this is called nutrition response testing. Now you can find more information on our website, nutritiontesting.com. What a cool website name, huh? I own that one. It goes right into the chiropractic website, ChattanoogaChiropractic.com, right to the nutrition pages. You can learn a lot more about it. And of course, when you come in, we have a coupon. It's $99, and it covers your full evaluation, that visit, and a follow-up visit for nutrition response testing for just $99. And of course, you just buy the supplements that you need. And it's a great way for you to go ahead and see what's going on. So I want to thank you for watching the video on nutrition response testing. I hope this clears things up. A lot of our patients were asking for more clarification. I always inform as I perform. As I'm going through testing, I tell you what I'm doing. I'm telling you why you need it and what it's doing to your body and what your body is saying that it needs to heal. And when you remove the barriers to healing, beautiful things can happen to your body. I'm Dr. Sean Jones, Director of Chattanooga Wellness Centers in Cleveland and Chattanooga. Our number is 423-790-5000. 423-790-5000. That's the Cleveland number. You can call that number and it will forward right to the other number, and we'll get back to you as soon as we can. At the other office, we're located at East Spring Road at Brander Road in Chattanooga, and we're right past Tanola Hospital on Chambliss Avenue Northwest, right in Cleveland, Tennessee. Thank you for watching, and please join our YouTube channel, and also like us on Facebook, Chattanooga Wellness.